everyone. Welcome to the Birth and Body podcast. This is Bethany Stricker, and I'm just thrilled you're tuning in. I'm a licensed midwife in the DFW, Texas area and serve families through the midwifery model of care by offering preconception counseling, prenatal care, and home and birth center birth. This podcast is all about women's stories and voices and meant to be an encouragement and resource for all things women's health and wellness. If you are enjoying the podcast, we would so appreciate your support so that we can continue offering this resource to families everywhere. Please visit the LiberaPay link below this video on YouTube or in the description wherever you are listening to the podcast. If you are a doula or childbirth educator and desire to further your education, or someday maybe you want to be a midwife, I would love for you to join my Steps to Midwifery group, where we study cases and go into detail about all the things we talk about on the podcast. Visit my website at bethanystricker.com for more information or to join the Steps to Midwifery group. Our guest today is Kiesha Baker, a licensed midwife who is my colleague, but also my current client and friend in real life. Kiesha and I are very like-minded in our style of practice of midwifery, and we have a great discussion today about informed consent and shared decision-making between patients and their midwives. I hope you enjoy the show. Okay. Welcome to the show, Kiesha. I'm so glad you're here. We often do births together and spend time together outside of births. We're good friends, midwife colleagues, all that stuff.
And you're my midwife.
Yeah.
Currently.
Which is super fun. I still feel so honored that you picked me.
Yeah.
So the reason why I thought to have you on the show was just being a midwife, not for very long, but a little bit of time, caring for different kinds of people with different backgrounds. Some have had babies before, sometimes with other midwives, no babies before, using OB, whatever. Often they come into care and are maybe surprised and sometimes don't quite know what to do with that we give them so much information about their options. Like, we really want them to be informed. I know you're really good about this with your clients too. And there's kind of different responses to that information. Like, sometimes which for us, I think is like the foundation of the midwifery model. Like, we never want anyone to feel forced to do anything. We want them to feel good about their decision. But sometimes they're like, oh my gosh, this is so much responsibility. Or sometimes they don't want to talk about their options at all. They just don't want to, sometimes they've had a bad hospital experience. So they just like, no, I don't want anything. Like, don't even bring it up,
Yeah.
So sometimes it's interesting to navigate as a midwife and a client, and you're kind of both right now. So I thought it would be fun to have you on the show to talk about how we, as clients and midwives, navigate it. So
It's been interesting to be on the other side. So there's 3 different models of care, and I'm now experiencing the third model.
Sure.
I've experienced all 3.
Yeah.
And I didn't think
so
about that
awesome.
at the time.
Yeah.
But so my first was with an OB in a hospital, and then the second was with a certified nurse midwife in a hospital. And then now here we are with a CPM out of hospital. And I think the biggest difference and why I wanted to become a CPM is the model of care and how it's so different. It's so tailored, to each person. But with that, you're really depending on the experience of the midwife to help you tailor your care. I feel like that's why you're hiring a midwife, So for me, it's really built on trust. I spent 6 years in primarily the hospital setting, and so I've seen a lot of things.
Sure.
And so when somebody is planning an out of hospital birth, it's my number one job to keep them safe. And so in order to keep them safe, we have to have a good foundation of trust. I think that's what it's built on. So I really try to establish that at the first appointment with my clients so that they understand, like, look, I want you to get, and I'm going to steal my preceptor's words, the candlelit Instagram birth that you see. Like, I want you to get that, but my job is to keep you safe. And so that might look like you taking on a larger role of responsibility than you previously had with your OB, or that might look like you considering to do some additional testing or to consider just some additional risk factors maybe you don't want to consider to keep you safe. So, I mean, I think for me, I will say if I can get that across in the interview or the first appointment, I don't get a whole lot of pushback. And I like the way that you handle it with me, and I feel like that's how I do with my clients is, okay, something comes up that we need to address, and you call me and say, or text me or whatever and say, well, what do you think? Like, how do you want to handle it? And give me the opportunity to say how I want to handle it. But then also, I paid you and hired you for your input.
Right.
And so I want to know what is it that you want me to do. And so I try to handle it that way with my clients, depending on their personality. I mean, some of them I know they just want me to tell them what to do. But others really do want to have the opportunity to tell me firsthand. And there's been times, depending on the situation, of me thinking that's probably not going to work, but okay, let's try that. Okay, great, we'll try that. For instance, like their hemoglobin. I have a lot of clients that are really heavy on their diet. They really want to use diet, which I love. But when a hemoglobin is a certain level, you kind of think that might be really hard to improve it with diet alone. Yeah. And so giving them that opportunity and explaining why, maybe I want to do a supplement as well, but hey, we can try it your way because we have time. But if we get to, a certain time frame and it's not up where we need it, then let's try this other way, and I've done that before too. So
yeah, kind of that shared decision making, like, this is the information I know as the midwife, but you are a person that knows your body best. What's actually going to work for you? Like in that situation, we have some clients that can't super change their diet, so supplements are going to be better, or they're nauseous, so they'd rather do liquid iron. Trying to tailor it to them and what's actually going to work. I think that's where we really shine as midwives. I recommend all kinds of different iron supplements because everyone needs, slightly different things. We don't have everyone takes this prenatal, everyone takes this iron. It's just,
and that's
all different for everybody depending on what they need.
Yeah, that's the beauty of what we do, I think, and that's all the way through the birth and even postpartum.
It's true. No one gives birth. I mean, we all have babies the same way, but actually we don't either. It's all different. Everyone's so different.
And each time it's different, So that's the interesting thing, to see a woman have multiple babies with us and see how different and similar sometimes, but different each of their labors can go. And so I remember learning that back in my lactation training, is just learning that no two mothers and two babies are alike. So that mama baby relationship is different each time for her. So we have to look at her differently. And I've experienced that. I'm sure you have too. And that's what can be a little bit tricky when you have somebody who's had a midwife before for 3 or 4 babies. And here we are on number 4 or 5. And we've got some interesting things popping up, and they're like, well, this didn't happen last time, or this has never happened to me before, and you're wanting to kind of manage this. And it's just, it's hard to explain to her that this is just a different baby. This is new. And so we might have to change up the plan and do things differently.
Absolutely. So. I think I have that a lot where maybe their midwife never tested them for gestational diabetes or never offered it. And I think sometimes that's a more challenging situation because as the midwife, maybe everyone feels differently about it as a mom, but thinking about and explaining, because I feel like a lot of our clients come in feeling like this is what I don't want because that's the medical model. And I don't want to feel like my body's broken and all these different things. So then explaining it as, no, it's helpful information. Like if we can keep your blood sugars nice and stable, you're going to have a nice size baby, not too big, not too small. Your baby's going to do better after. It doesn't have to be this medical thing.
Right. I think part of it is just taking the time to explain it to them, and if I've done a good job at informing them on whatever test it is or protocol that we're wanting to do, then I also feel much better about them declining it. And I also don't often have people really rare. I say that and I'm going to have 3 people decline things this week. But I
feel you. 100%.
But I don't, when you explain to them, for instance, I know this is a common one, a biophysical profile. We were talking about this recently. 41 weeks for that last week. The protocol would be every 3 days. We repeat it. And that's
specifically because the placenta, after
and
post
so that's why. And so, if they first off hear it, it's like, no, wait, I'm not late. 42 weeks. Like I can go to 42 weeks, because that's what they hear on like the Facebook message boards and everything. And you're like, yes, of course. But when you've seen a placenta give out, there's a reality there. And so explaining to them, like, we want to check on your baby's health, and here's why, because your placenta is an organ. It's a filtration system that gets old and it gets tired. And if it gets too tired, you just go through all the pieces of it, and then people understand, and they're like, okay, absolutely. I want to do that. So it has nothing to do with them being late. It just has to do with their placenta working well for us, so that we can have that out of hospital birth that they want.
Right. And decline that induction, like that screening process. It's always the screening to say everything's still normal. Let's keep going, whereas, maybe a client wants to decline a screening, but then we don't fully know, is this a normal pregnancy? Is this a normal baby? Kind of like we've talked about before too. Anatomy scans. Yeah. Well, again, I sound like a broken record with it, but it's, we screen the mother when she comes into our care to make sure she is a good candidate for out of hospital birth. So I feel like that those few screenings that we have for baby are to ensure that they now are a good candidate for out of hospital birth. And for me, again, that kind of goes back to just the things I've seen in the hospital setting, where something with a baby that maybe we haven't caught before even, but you catch on a scan, we can prepare for in a hospital setting and know that, okay, that baby has a whole team behind them. You've met with those doctors that are going to take care of the baby. You have a plan in place. Whereas if the baby's born at home, if the baby's not a good candidate for home birth, you have a much bigger problem, So that's my own personal experience that I've seen. And so I'm a little biased because I want to make sure that your baby can do well too. Right.
So.
Right. Yeah. Because we, as out of hospital midwives, we're prepared for term babies who are normal and have, normal structures. If they need help breathing, we've got that all ready to go. About 5% of babies need help breathing. We're ready to go for that. Normal mom, normal baby, low risk. Whereas anatomy scan, I've had heart defects, cleft lip and palates, and some things that are really rare. And if they would not have had an anatomy scan, it would have potentially been a surprise at birth, and we can't give them what they need right then.
Right then. To be, a totally fine outcome. That's the thing. So, you kind of go from, we have to have a plan in place, but the outcome's going to be great. We have a great prognosis to if that baby's born and doesn't have a team for it ready to go with the specifics that it needs, then we could be in a tough situation. So, and I think, again, that goes back to just, it's my job to keep you safe, and so your baby's safe and you safe. And that's really the end goal, right? We want you to have a great, informed, empowered birth. I would love to not touch you in labor, but you pay us and hire us for insurance and assurance. That's what we're there for, and hopefully we just need to give you assurance and there's no insurance involved.
Right.
But that's what it's for.
Right. We've all had situations of completely low risk moms, and they have done everything we've asked. They've had great births before, and it goes completely sideways.
Oh, yeah.
And I think what is hard for people is they think we all do it. We think if we do everything right, life is going to go a certain way. And in birth and in life. That's just not true. I think we think it somehow reflects on me if I hemorrhage, but I did all the things. It does not mean you did anything wrong. And so I've had moms maybe tempted to go unassisted because they have a great obstetrical history. And they're doing all the things. And maybe they're a midwifery student too. Who knows? Like, they just feel like, I'm the best candidate ever for this. But you just you can't predict. You know?
That's right.
Like my cord prolapse client, perfect, like 5th baby, perfect natural birth for all the others. And there was nothing she could have done to prevent that. And, you know, we resuscitate for 20 minutes and her baby is great. But that would not have been the same if she didn't have a midwife there.
Oh, yeah. Definitely.
And I don't know if it would have been the same even if she planned a hospital birth. Because she probably would not have been. I think
it would have been worse.
She wouldn't have been necessarily at the hospital yet. So that's a whole other thing.
Yeah. I've played through that actual scenario that you're speaking of in my head for you. And I'm like, I think in any other instance that baby would not have done well because the amount of hospital births I've attended, I think what would have happened, she would have probably been in there on her own when that happened. And it would have taken a few minutes. You know, if she's natural, they're not going to be continuously monitoring because that's not their protocol either. So there's no one in there present. And there just would have been a delay. It wouldn't have been the hospital's fault. Just there would have been a delay. I really think in any other scenario, the baby wouldn't have done well. So, you know, we've seen too many of those. I mean, you and I just had one that her previous birth had all been very quick, very smooth. And this one was a 5-minute shoulder dystocia. The baby was much bigger than her others and definitely threw her off. She was surprised, you know,
right?
Was everyone. So you just can't plan. And so that's why we have to treat each pregnancy different, each baby, each labor different. We always have to expect the unexpected. And so with that means we can't just assume that because you've never had gestational diabetes that you're not going to have it this time. You know, we have to always pay attention to you and your baby because we've got 2 clients, not just one, you know, and they're all different. And so that's where it comes into play where we may be asking you to do some things you've never done before and making that decision in a shared way where we can talk about it, that the client can feel comfortable and understand what they're doing and why they're doing it. Today I had my glucose screen, and I shared about it on my social media because I kind of wanted people to see, hey, look, I'm drinking the drink. But with that, I offer many options to my clients. And I had another midwife reach out to me and she's like, I'm so surprised you're doing that. Why? You know, and so I explained to her what my reasoning was. And she was like, oh, wow. You know, she goes, you're really good at that with your clients at explaining the reason why. And I said, well, it's because I was a doula. Sometimes I probably over explain, but I had a reason behind why I wanted to do the drink, you know, and so I want my clients to understand the reasons behind all the options. That way they can make the best choice for them.
Right. And I think that's important to keep in mind is that when we bring up options and want you to know all the angles, it's simply that to make the best decision for you and your baby and your pregnancy and your family versus how it often comes across with a doctor of they keep bringing up vitamin K because they're pressuring me and I'm afraid they're going to call CPS or something, you know, whereas no, we just want you to know the risk and benefit of vitamin K to prevent hemorrhagic disease of the newborn, or, you know, if you're concerned about the ingredients, you know, you can decline, but you need to know all the angles. So because it really is, you're taking on that liability whenever you refuse something and you have to be okay with that as a parent, you know, at the end of you live with it or whatever, not the midwife. We're just there to guide. We're like what is it? The Sherpa on have you heard that saying?
No.
It's like, the guide on the hike, that huge mountain in Peru. I'm looking so bad right now. You know, it's like that huge mountain in the Andes. The Sherpa.
I know what you're talking about. I get what you're saying. Well, okay, when I was a doula, people would ask what a doula was, and I'm so terrible at like explaining what a doula is because I really feel like it's different for every person to a degree what you end up doing. So it can be kind of hard to give an elevator speech on it. But I stole this from my partner, Becky. She talked about if you're planning a trip, a hike up a mountain.
Exactly.
And you spent all this money, all this time, this investment. I mean, it's going to take you 9 months to plan this thing out. You bought all the books, you read it, you probably took some classes. You're not in it alone. You're there with your partner because you wanted to experience this together. And you get there, you have the choice to hire a guide or not. So you get going, say you don't hire the guide and you get bit by a spider 3 hours up. And you're like, well, am I going to lose my arm? Like, do I need to go back down or can I keep going? And the guide's there to say, oh, that's harmless. You can keep going. Or, oh, hey, I have this in my pack.
Right.
Let's bandage it up. We can keep going. Or, hey, we do need to go back down the mountain, you know? And so that's what we do.
Right. So. Right. Know your options. Keep safe. When do we need more? Surveillance, whatever. And when is it just fine? Let's just keep going with the plan.
Yeah.
Yeah. That's so true. That's so true.
Yeah. So I have used that for a long time. It's the same with midwives as well. The difference is when the doula gets there, they like drop you off. Not really. Right. You know, it's like, here we go. No, they're not held, liable medically speaking. So,
yeah.
But
for that client you mentioned kind of at the beginning, that feels like, just tell me what to do. That can be really hard to navigate. I have clients a lot that are just like, well, when you have a baby, what are you going to do? And I avoid that question like the plague.
Yeah, me too.
Because I'm like, I can't just tell you what I would do because everyone's situation is different. And how we quantify risk is so different.
Only you can know that risk.
Right.
Yeah. It's been a lot harder for me pregnant. I've had more and more of my clients go, what are you going to do? What are you going to do?
Yep.
Or what did you do even? What did you do? What are you going to do? And so it's a challenge. Vitamin K is actually the number one. That's actually the number one question I get. The hardest one. Yeah. I'm not going to give an answer right now.
I know. I avoid it. Like, don't give an answer on video or recording.
Because it's so challenging. That's one of the hardest ones I feel like I face with my clients because it is so individual. And we really do need you to do the research.
Right. And I feel, even for me personally, I've changed my mind over time with the more research that comes out. When I was a doula, like attending my first birth about 10 years ago, we were still worried about vitamin K and the study, causing childhood leukemia. Now that's been disproven, and now we're more, concerned about how many babies, even we've had a couple here, even in DFW, that their baby experienced the hemorrhagic disease of the newborn. So it's not this like theoretical thing. It's more like this actually does happen, and really comparing the risk of the ingredients and the shot to this could actually happen,
Right. Exactly.
And so I change my mind all the time. We recently did, Melanie Shaw, she's a nurse practitioner, came and did that training for North Texas midwives on pharmacology for midwives. And she shared new information on the oral drops of vitamin K I'd never even heard. So I'm like, okay, now I'm taking that, So people, I think, change their mind with different pregnancies too. And that's okay.
Yeah.
There's not a right or wrong.
The hardest thing we face today, I think, is social media. Right, in every area of our lives.
True.
But as the midwives, because I had a good friend of mine whose baby was born early recently tell me at dinner, she was like, I just hate that I gave him the vitamin K. I hate that I did it. And I was like, why do you hate that you did it? I just hate that I injected something in him. And I was like, well, at 33 weeks, that is a very different story because they are at that much more risk, So I started to explain that to her, and she's like, oh my goodness, I'm so glad I gave him the vitamin K. Like she totally changed the way she thought. Now, everybody might not feel that way, but her whole basis of it was things that she had been seeing on social media, right? And one-sided. And that's where I think our job and our responsibility as midwives, and not all midwives are good at this, is giving all sides, But again, that comes back to trust, and you should establish that trust with your midwife on day one. And if you can't fully trust your midwife, then you need to find a new one, because it's just as tough for the midwife as it is for the client. If you're like, why did you hire me? Like every time they come in and sit down, they listen to nothing that you say, and you're like, why did you hire me? It should be a really personal experience.
Right.
And if it can't be, then then they should find somebody that it can be.
Right.
That's what this is. I mean, each baby, you only get to do this once. So you need to find somebody that you can trust. And then when
Right.
you sit in front of them and they give you some, piece of information, that you can listen and you can take it and you can maybe go research it, or maybe you don't need to because you trust them. But whatever that is,
Right.
you can do something with it.
Absolutely. Because it's true. You can find midwives that aren't going to talk to you about your options. They're going to show up and listen to the baby and take your blood pressure, and that's it. And they're not really going to recommend biophysics. So if you want that, you can find it.
Yeah, that's the thing. You can, there's a midwife for everybody. And that is so true, because there are certain clients that are probably not a good fit for me.
Sure. Me too.
Yeah, I mean, I have, and I totally understand. For instance, there's certain risk factors I won't take, but I think women should totally get the shot at doing it out of hospital. It's just for me, I'm not comfortable with it.
Right.
And so I have those midwives that I will refer to.
Right.
I can find you a midwife that fits you, and that's great.
Mm-hmm.
That's the beauty of midwifery care, is that there's so many of us that are so different that we can meet your need, because we all worked really hard, but I more recently worked really hard for my license. And so for me, there's just certain liabilities that I'm not willing to take on.
Right. Yeah, I think that's true too. I think a lot of people aren't used to seeing their care provider, whoever it is, as a person who has boundaries for whatever reason and has a family. And however that person makes their boundary, there's a reason,
right. I mean, I've seen that with OBs over the years.
Absolutely.
And that's probably one of my biggest pet peeves online, again, on social media, is when a baby's breech, right? So you and I will both attend and deliver breech babies. We both have a passion for that.
Yeah,
so
we love breeches.
Yeah, so I'm like, let's do it. But
under certain conditions.
Yes. Right.
Disclaimer.
That's true. Let's do it, though. Let's do it. But you see on social media these mamas that want to have a vaginal breech so bad. And so the question comes, I mean, I feel like I see it once a week. It's like, can I just walk in complete at 10 centimeters and then they have to deliver the baby? And it's like, oh, no, you don't want to do that, because they're not trained. They're not comfortable. You don't want a provider to do something that they're not comfortable with, because there's a reason they're not comfortable with it. And so you need to find the provider that is,
right.
And so my respect in OBs for that has changed a little bit, and I'll say that just as much with midwives as OBs, you can find the OBs that explain and
absolutely
give you all your options versus the ones that don't. So I don't, that's not necessarily model of care. Again, that goes back to personality, fit, style.
Right. It's actually how I came up with, I should talk to Kiesha about this, because I was listening to a continuing education class by an OB who was talking about informed consent for vaginal breech births. And it was a whole hour long. And he, had his PowerPoint and explained, I explained how the cardinal movements of breech birth works, how the baby moves through the pelvis. And then he, is explaining, I start with this because then the parents understand it can be quite normal to have a baby that way. And then they can understand these are the things that could potentially happen also. So it's just a great, his informed consent was so good. But it takes, and he said, I go through it exactly like this, and it takes me an hour.
Wow.
Which I want to say he was from Australia, which totally makes sense because it's a big decision and they need to fully understand what they're taking on. And it's not as simple as just showing up at the hospital, because that comment does show not quite the full understanding of risk benefit of vaginal breech,
Yeah, definitely.
For sure. Because you want to show up with someone who knows how to help you have your baby that way. Just like if something potentially goes wrong, that Sherpa helping you cannot help you.
Yeah.
Literally, you don't want anyone on that hike with you.
I'm like,
none of those nurses, you don't want any of those people with you for having a vaginal breech. They're not going to help you. They're just going to be like, let's jump off.
I mean, they
like, they're not going to know what to do.
They don't know what to do. And it's not their fault. They're not trained to do it anymore. And if they are, it's like, it was a long time ago. you know,
Right.
if this ever happens. And they're just trained in a very different way than we are. So yeah, I think that's an instance where the safety net of a hospital is not quite
Right.
there, because unless you have a skilled OB who still does it, which they're great, you know.
There are some,
and we're lucky to know a few around here, but they still do it differently. The last breach I had in a hospital, I had to turn away. I was like, oh my gosh, they're gonna get the head stuck. Like, I can't look because they just do it so differently than we do it, and so it's challenging, you know, to see it done so different. It's the same with shoulder dystocia. That's one obstetric emergency that I would prefer a midwife to handle. Which I know that's one of the biggest, scariest things that can come up for out-of-hospital birth people think about. For me personally, because I know how we handle it versus I've seen it handled in a hospital setting, I just feel more comfortable with a midwife handling it. So there's less fear there for me.
Absolutely.
Because I just understand the way that we handle it. But that's me, you know, and that's not everybody.
Sure.
Not for everybody. I'm always so... trying to do both playing fields, because out of hospital birth's not for everybody. And that's the other side of this in terms of shared decision making. I mean, a midwife is not for everyone, whether it be because they're just not a good candidate, or maybe they get into it and realize, no, like, this really is not for me, you know, and that's okay, because it is a different model. There is responsibility that they have, where we ask them to do things. They have to stay healthy.
Right.
You know, they have to stay low risk so that they can get this birth that they're hoping for out of hospital. And so there's a lot of responsibility on their part.
For sure. I think you probably feel the same way. I feel responsible at the end of the day before God for that I told you the things so that you can make the best decision for you and your family versus, oh, you don't need to worry about that. A lot of midwives say that. They brush it off and aren't really giving informed consent for the options. And I think and doctors do it too. You know, they're the other option of just give everything to everyone. And then often they don't allow some low risk women to decline things they maybe don't need.
Which can put them at risk as well. Doing
too many ultrasounds can also be risky. You know, serial ultrasounds that lead you to an induction you probably didn't need. That's really risky too. Yeah, but it's so about being ethical at the end of the day. It's not,
Yeah. The quote I use with my clients a lot, and this is based on my belief system, but I use it with everybody, is that we're broken people in a broken world. You can't help that you fell on your hip when you were 2.
Right.
I jokingly say, if you eat Chick-fil-A one time your whole pregnancy, you have to do the glucose test. And I've yet to have one person say, I'm not. No, I recently had somebody go, I'm not going to do that. I was like, great, then you don't have to do it, you know. But there's just the reality of our imperfections play in. And we don't expect you to be perfect. So because of that, we need to see how are those imperfections affecting your risk factor or your baby's risk factor.
It doesn't mean your body's broken or anything
Not
like
at
that.
all.
You know, like for me personally, I grew up eating Popeyes and Mountain Dew. Like, especially when I was a teenager. So all of like my developmental years, it's totally impacted my hormones and insulin resistance. And I have to do the GD screen. Like, I already know I'm slightly insulin resistant. Like, glucose does not get into my cells. It just like floats around and doesn't know what to do. So, and I look low risk from the outside.
Right. Yeah, if I were to do your intake with what you'd be
eat,
like, I'm like, oh, you eat great.
You don't need it. Most midwives would say you don't need to do it. But I know the way pregnancy changes you, you become more insulin resistant. And I probably can't have a 10-pound baby. Let's be honest. If you haven't seen me in person, I'm 5 feet tall. Like, I was 6 pounds.
Maybe
my
8.
mom's 5'2". I don't even want to try it.
I feel confident in a good size.
My sister and I were both 6 pounds. Like, no, I don't need to do that. So it's not to say I can't. Like, women can have big babies, but I also really want to have my vaginal birth.
Right.
The way I want to have it. And so for me, really monitoring my blood sugars is really worth it to me.
But what's not fair, I mean, you're a midwife and you know that, right?
Sure.
But what's not fair is to just look at you and say, you don't need to worry about that.
That
and
I would be so upset as a
right.
client if I ended up transporting for this huge baby, having an epidural, potentially a C-section, and I didn't know I could have done something to prevent that. I would,
I mean, I have that exact scenario right now.
Yeah.
I have that exact scenario right now. I mean, she's with me for her second.
Yeah.
And that's exactly how it played out. I was her doula. So therefore I saw it all play out. The transport, the whole 9 yards. And and I was concerned towards the end of the pregnancy because I'm just like, she's measuring bigger and bigger. You know, there's a lot of things, but it wasn't my role because I was not the midwife.
Yeah.
And so we're handling things much different this time now. Maybe she'll grow a baby the same size, but based on blood sugar levels of the baby after the baby was born, it was pretty clear that's what was going on. So I just think it's fair for us to, again, look at you as an individual, look at your baby as an individual, you know, each time, talk about it. Again, I just don't have much pushback from people. I find that if I explain it, they understand it, then
right.
And maybe they do push back, but the times that they do, I suppose I understand where they're coming from. I'm like, oh, that makes sense. Like we've talked about it. You understand the risk. Oh, that makes complete sense. Why you don't want to do it. I'm on board.
Right.
You know, and as long as I have a good reason that I can chart, you know, as to why we're declining something, then
right.
That's fine.
Because when we know you understand, I fully respect. You've educated yourself. You're an adult. You're about to have a baby. You can make all the decisions. You know, that's really, most of the time we're okay with declining. You know, we just want people to understand and not write us off.
Sure. Yeah.
At least that's where I'm at.
Yeah.
But it does take time. Like, it takes a lot of time to, like, research things. It's investment.
It does. It does take time.
Yeah.
Yeah. And I can't imagine. I mean, we spend so many years educating ourselves on all these little issues. And then still, you know, I mean, how many times do you get a question from a client and you're like, oh, so then you spend 2 hours that night researching.
Right.
I think I spent like 6 hours researching vitamin K towards the end of my apprenticeship because I had some clients that just really wanted good information on it. And, you know, the good news is I, for the first time, really came to terms with what I felt strongly about with it because it forced me to. But it takes a lot of time and investment to come up with an answer or protocol for each of these little situations, you know?
Yeah. Yeah.
So I understand, which is why, again, though, you hired someone. So we spent the 6 hours.
Right.
And now we can give you the information. So maybe you can spend the hour.
Right.
And then you can decide.
Get the rundown, the general idea, and then look at, totally.
Yeah.
Yeah. Yeah. As a midwife and a pregnant person, any tips you want to leave with maybe pregnant moms that are maybe anxiety from all the decisions? Like any tips you would want to give them for perspective or just as they go about the decision-making process with all these things they have to decide on?
Well, first of all, it's like welcome to parenthood.
Yeah.
Because you kind of just have to get used to things maybe not going as planned. And that's why hiring a team that you trust, like totally trust, is huge. So if you're not with a provider that you feel 100% comfortable with, you can ask anything of, that you trust the information that they're giving you, then you need to find a different one and do it. I mean, coming from someone where this is their third, do that. And it doesn't matter if you're at the very end, you know, because I think the anxieties are normal. And that doesn't change with each baby. They're just different each time. But having somebody around you that you trust, that when they say to you, you don't need to worry about that, or let me just listen to you, or that's reasonable, that you trust that, you know, because I think in the past with providers, I didn't really trust that. And then, and for good reason.
Right.
So,
yeah. And I think kind of the other way too, like we've talked about that earlier, like if she also says, no, I think you should, whatever, you have that trust where you're like, okay, she's not going to tell me something that's unnecessary.
Well, because when it comes down to it, in the moment at a birth, if you're having your beautiful candlelit water birth and she says, get out of the tub, we got to have a baby.
Yeah.
You've got to trust and not second guess why she's telling you to do that. You got to get out, you got to do it because she's trying to keep you safe. So all of that's important. And then I've seen that too with providers when you have to make when you have to make a decision for an intervention. That's the difference of the trauma oftentimes for moms is them trusting their provider, you know, because I've heard women say to me, oh, this happened. This was so terrible. The doctor did X, Y, Z. And that actually happened to me with my first. I thought, oh, they were so terrible. They did this, this, and this. And then once I became a birth worker, I realized, oh my gosh, no, they did the least that they needed to do. I didn't have to have C-section. It was a low intervention for what was going on.
Yeah.
But I didn't understand that because I didn't trust them, you know? And so when you trust them, then you have that opportunity to understand they wouldn't have done it unless it was needed. And then you could talk about it after. So
Totally. And we want to talk about it after and just process and
yeah, definitely.
what midwives are
Which
great
is
at.
the beauty of seeing you multiple times postpartum.
Yes,
right.
all the postpartum visits.
Yeah.
Well, thank you for coming on the show, Kiesha.
Yeah.
I so appreciate it. Kind of late at night.
It's fine. I know.
After a long day. So thank you.
My carriage is going to turn into a pumpkin.
Yeah.
My pregnant carriage.
Let us know what you want to hear about. And if you've made it all the way to the end, please leave us a review. We would so appreciate that. Share about it. You can find like more updates and things like that on my Instagram or Facebook. It's at Bethany Stricker Midwifery on Instagram, Bethany Stricker Midwifery Care on Facebook, and then just BethanyStricker.com for website stuff. And yeah, make sure you subscribe on Spotify or Apple so you can get notifications for further podcasts. Thanks for listening. Bye.